Assalamualaikum warahmatullahi wabarakatuh. Good morning. Thank you very much for the slides not yet. Okay, yes, thank you. Thank you for the opportunity to Indian Eye Bank. So now I will talk about the Eye Bank in Indonesia, how we develop the hospital cornea retrieval program in our hospital. So no conflict of interest. So as I would like to introduce that this is the condition of iBank in Indonesia, which mostly handled by the iBank of Indonesia. It's not the national iBank, but it's a voluntary iBank, which already start their collecting data from maybe 20 years ago, and then now we are developing our hospital iBank, which come from the government support of the iBank. Okay, so this is the corneal blind issue in Indonesia. The leading cause is still the infection and also the PBK, which commonly found among farmers and also fisheries related to the occupation. And the prevalence of corneal scarring is about 1% in both eye and 0.5 in one eye. And then in our hospital, the recipient waiting list is around 165 people, and since waiting up until 2022. The Bank Mata Indonesia, the community-based iBank, support the local donor cornea from around 250 per year. Based on that kind of background, we start to think about developing the hospital corneal retrieval program, which have a reliable medical history, and we learn also from the India that the younger individual and reduction the time of interval and cost effective. So finally, we try to learn from several papers mentioned about how the hospital retrieval corneal program will give increase on the utilization of the cornea. And then we also learn about some religious causes, the family not satisfied with the hospital treatment, like some of these kind of lists in the table, is we should understand the difference in social condition, which can play a role in counseling method and approach of potential donor. That's why we try to manage a counseling system in our iBank. So we know that the role of counselor and also the health worker could influence the 68% of donor families, and also the health worker interaction with the patient and also the family during the treatment affect trust in organ donation, and therefore the collaboration between the entire system of the hospital will play a crucial role in developing the HCRP. So I would like to talk about the experience in our developing cornea retrieval program in our hospital. So this is in the iBank in the tertiary government-supported hospital in Indonesia, in Jakarta. It unit structurally beyond the hospital director, and we coordinate with the transplant unit in our hospital. It consists of multidisciplinary team, which consists of ophthalmologists, psychiatrists, internists from the palliative subspecialty, the forensic doctor, nurses, medical social worker, and also the laboratory analysts. So we start with developing the counseling curriculum, and then we also train the iBank technician. We send 3 of our iBank technician to Nepal. Thank you very much for having our technician there. So because we just start our iBank on last year, October, so it's very baby, very small step for our hospital iBank. And then we also have the coordinator with the transplant center in our hospital. And we also have the affiliated with the Indonesian National Brain Death Referral System. Thankfully, we collect one donor from the brain death person suggested from the Indonesian National System. And then we also do the online counseling. So when we have one single potential donor, we also offer the online counseling and also the offline counseling. It really helps for the potential donor to make their decision. And also we also perform the iBank roadshow through whole the hospital, because we need to introduce our system in our whole hospital. And we also the raising awareness regarding the religion matter, and also all the hospital banner, and we also make online education videos through the hospital waiting room. And we also try to develop our own iBank app we'll develop the donor registration, the death alert, the allocation, and also the waiting list and grading score. We learned a lot from previous presentation from all the iBank that how to we develop the grading system and also the decided which one is the potential recipient, and also for the follow-up information. So what kind of difficulties that we found? There's still a stigma and awareness, like the religion, family approval, cornea recipient, and also the organ trade or trafficking. And also we have like difficulties, including the importation. Like right now, we cannot get any donor from abroad because some problem in the bureaucracy of our custom and tax. So since October, we cannot get any other donor imported from usually from Nepal and from the US. That's still we try to manage it as our problem, and we still try to collect grant for developing the iBank and then get the fund from the government and also from the NGO. I think that's all. Thank you very much. Okay. Thank you very much. Thank you very much. Yeah.